Good afternoon, everybody. Jim Arroyo here, Oath Keepers of Yavapai County and Arizona State Vice President for the Oath Keeper chapter in our state. I run the Yavapai County team, which is the largest active team in the United States. We're now really close to 600 members on our email roster, and the only way you get on our email list, you've got to come to a meeting and train with us. So we're growing at a rapid pace. This show is 100% dedicated to the Oath Keeper mission and the Yavapai County Preparedness Team. YCPT is our corporate structure, but we are still Oath Keepers. We are active and we are working, and we've got a lot of stuff to train you guys in because time is very short right now. Personally, you guys know the different teams we have: our medical, our preparedness, communications, engineering, our home medicine team. We have an intelligence unit. We're now getting ready to set up a field kitchen team. So we're growing at a rapid pace. But personally, I sit on the medical team, and I'm one of the instructors. We teach Stop the Bleed. We teach 2 military standards. Everything we learn and everything we teach comes from active duty experience, and it is vital to have good medical skills, because in the future, if this goes sideways and lead starts flying and you guys start participating in the two-way rifle range out there, you're going to need your medical skill sets rather quickly. So let's talk a little bit about, we went over this in our meeting Saturday, and I want to give you guys some basic guidelines of what you need to start training in right away. If you haven't done this, for you CERT team members out there, the Community Emergency Response Teams, you know that we train in the medical portion of our training in triage, and that's learning to use the triage tags, learning how to triage a mass casualty. So what I want to tell you about, and there's a lot of confusion out there as to how this works. All right, basically the word triage is a French word, means to sort. It is only used in mass casualty. Okay, if you have 2 or 3 victims you're dealing with in a car accident and you're by yourself, you're going to have to triage and determine the course of action for each of those victims. All right, if it's a mass shooting where there's 20, 30 people, and these have happened, we've seen these happen, and you're one of the few medics that might be on scene or somebody who has capabilities in a mass shooting, triage is absolutely critical. The basics of it are, you're going to check someone's airway. If they're down, you're going to reposition the head. If there's an airway opening and they're breathing, you go on to the next step. Are they breathing at less than 30 breaths per minute or more than 30 breaths per minute? Less, delayed; more, immediate. Then you're going to go on to circulation. You're going to check and simply press the nail bed, check their circulation. Obviously, if there's a massive bleed, you're going to need to stop that immediately, but you need to sort them first and let the medics come in behind if you're doing the triage portion of the show. But you need to know where they are in their circulation. And the last part of triage is their mental status. If they're alert, are they unconscious? Are they able to answer a question? We tell them squeeze our hands, both hands. Okay? If they can follow a simple command, that tells you part of their alert status is good. If they can't follow a simple command, that makes them an immediate. If they do follow it, they're delayed. But there are techniques to this. Look it up online, get the techniques, get some triage cards, order them up, and have them ready to go. This is absolutely vital if you're going to be dealing with any kind of numbers and you're by yourself. Once you have the triage portion of the show done, then you're going to go, if you're a medic on scene that's going to be treating casualties, then we go into our march pause algorithm. And we've talked about this before. Let's go over it quickly. This was developed for the US military, and it's pretty much commonly used now. You hear the march algorithm talked about all the time, and then I'll explain the pause. This came along later. So the term march, M, massive hemorrhage. It has been proven that the #1 cause of death on the battlefield is exsanguination. That's a fancy medical term for the guy just bled out. So what you want to do is stop massive bleeding. All right? That's arterial, whether it's brachial artery on the arm, femoral artery on the leg, neck wounds. You've got to stop that massive hemorrhage of arterial bleeding in under 3 minutes, or he's going to bleed out. and then it's game over. So massive hemorrhage. A is for airway. You're going to open an airway, make sure they're able to breathe. If not, you've got to clear that airway because that's the next critical thing. If the airway is open, you go into R, respiration. Where is their respiration? Are they breathing heavy? Are they breathing shallow? You're going to want to note that. You're going to start to treat whether you're going to put in an OPA, oral pharyngeal airway, or an NPA, nasopharyngeal airway through the nasal tube. These are areas that you have to get opened up so that they can breathe. The C, circulation. All right, this gets into how is their blood pressure. This is where it can end up using an IV. Most of you aren't going to have IVs or capable of doing that, so move on past this one. If you are a trained professional and you have that capability, this is where you're going to insert an IV. And then H, head hypothermia. You're checking for head wounds, and then you want to cover them up and begin the treatment of shock. Hypothermia, it doesn't matter what the temperature is. You start to lose blood volume or water, you're going to go into shock. So the March algorithm would be next in your initial assessment and treatment of a casualty. Then pause deals with secondary assessment and treatment. The P for pause is pain. That's where you're going to administer the pain pack. The A is for antibiotics. And issue the antibiotic pack if it's in their Ifak, and we'll talk about that in the kits in a minute here. The W, you're going to start to treat the other wounds, superficial wounds. Stopping minor bleeding is not a major priority, but eventually you're going to need to treat those, so you're going to start to bandage them up and deal with that. And then the S is the splinting of broken bones. Nobody ever died of a broken bone unless it was a compound fracture and it severed an artery and they bled out. But a standard breaking of a bone and a fracture, hairline fractures, yeah, they hurt like the dickens, but you know what? You're not going to die from that. So that's the last thing you worry about treating. So once you've triaged a mass casualty situation, you've gone into your algorithm if you're a treating medic on scene, and this is what we teach all of our trauma teams to work within these parameters. And it's a good way to have a set of guidelines of how you're going to train the new people. Next, you're going to go into vital signs. And this is critical. What we've done is we actually made up a card that we laminated, and we give this to all of our medics. It's a good thing to keep with you. And it goes over the 6 vital signs that you're going to want to track. Number one, when you go into any hospital and you're injured or you're sick or there's something wrong, the first thing that's going to happen is they're going to come in and they're going to sit you down in a room, and the nurse is going to come in and start asking you a series of questions. And then she's going to check certain vital signs. The number one thing they're going to want to do is know your pain level. What's your pain? From 0 to 10, 10 being worst pain on the planet, where do you fall within that? That's going to start to give them an idea of what they're going to need to do in your treatment. The next one is the pulse, the heart rate. Okay, average pulse 72. Somebody comes in and their pulse is weak and thready, that's critical. You're going to want to deal with that. If it's really high, there's another problem. So your average pulse is going to be about 72. Respiration, 12 to 20 breaths per minute. Again, if somebody is breathing at less than 30 breaths per minute, that would be a delayed in your triage, but that means in a hospital setting, 30 breaths per minute is pretty high. Anything above that is really not good. Blood oxygen level, that's a pulse oximeter is what you need. I have mine here. This is the one I actually carry with me in the field and use. It's very simple. You stick your finger in there, you press the button, and in a very short amount of time, it's going to come up with a number. And it's going to give the pulse and the blood oxygen. So right now I'm at 97, my pulse is at 76. It's a little high right now because I'm all wired out of my mind training you guys, which is what I do for a living. So it's not very high, 76 is good. I was at 97 on there. 97 is right down the middle. That means my blood oxygen is almost perfect, between 95 and 100%. So get yourself a pulse oximeter. That's very handy when you're doing vital signs. You're doing 2 things at once. And I'll show you another trick when we get to blood pressure. Temperature, you're going to need a thermometer. Obviously 98.6, we're going to want to monitor temperature. Then when it comes to blood pressure, I do not have a sphygmomanometer here or my stethoscope. I do use that, but I'm going to show you a trick that's much easier. This is a wrist cuff. It's very simple. You hook it onto your wrist. I'd have to take my watch off. bring it around, press the button. This is what I use to check my blood pressure at night. I'm kind of a heavily wired guy, so my blood pressure generally runs high anyway. But this is something you can put on the victim while that's checking. You've got their pulse oximeter, so you're doing two things at once. And that way you can check other issues without having to spend a lot of time. Blood pressure with a sphygmomanometer requires a lot of training, a lot of technique. You can learn this online, it's not that difficult. But what the main thing is with vital signs is you want to do this about every 15 minutes on a casualty or once they're in a rear setting. One trick we use in the field in our initial assessment is we've got these little pads, got all of the little details on there, and it has the patient's name, male or female. You put their age, you take their blood pressure, pulse, respiration, skin color. Is it cool, clammy, is it grayish? Skin tone is critical. That can tell you if there's a circulation problem. Their temperature, the time and date you took it. Again, just like in a salute report, this is critical. You want that time and date, and then you're going to monitor this every 15 minutes, and that's going to tell you if the patient is stabilized or if he's decreasing in quality of life there. Is he on any medications? Are there any allergies? That's important. If you can get that information, if the patient's able to give that to you, document that. And then initial assessments, and then there's a chart on there with the body so you can make notes as to where there may be a wound or an injury. So this is put out by EMI. You can find different things like this online, but your medics should all be carrying vital signs notepads so that you can document that sort of thing. The cheat sheets are very helpful. Once you're experienced, you'll memorize all this stuff, not a problem. But training brand new people, they can keep this with them and they can start to run down the list. So that's it. When you're dealing with mass casualty and in the event you can't get them transported right away, you're going to need to begin some sort of treatment on those. We train all of our guys at this stage of the game. The object of the game is to make the victim someone else's problem. What that means is the paramedics have arrived, the ambulance has arrived with a paramedic or an EMT on board, and you can start to transport them to the hospital. You send whatever documentation you have with them, and they're going to redo it all over again over there anyway. But the idea is make them someone else's problem. If you get to the situation where we're in a civil unrest environment and there is no transportation, and as you have seen in Portland, Oregon, where they had a lot of problems, Seattle, Washington, the paramedics won't go in because the police can't escort them, so it's not safe. If there are casualties and injuries, you're going to have to deal with those on your own, and there are certain types of medical kits that we're going to talk about in the next segment that'll explain how a lot of that works. But most importantly, to start to train your medical people, try to find a doctor or a nurse, preferably somebody with trauma experience. That's going to be a big help, and we'll explain a little bit more about that. So triage, march pause algorithm, take the vital signs. This is the beginning phases of how you're going to start to treat casualties. As we covered before, we want you guys to get trained up in triage for sure, to at least CERT team levels. Learn how to use the cards, learn the march pause algorithm. Everything I'm telling you right now is online. You can go on YouTube and get the latest training on all of this stuff. Our medics from overseas have done a wonderful job at training and putting out videos to help the civilian community learn how to do these things. So learn your march pause algorithm and then learn how to take vital signs. If you can get that much done, you will have a terrific medical team. So let's talk about medical kits right now. I've just brought a few samples. You guys have seen a lot of this stuff. The kits that I have here, the company I deal with is called Elite First Aid, E-L-I-T-E, First Aid, Inc., I-N-C. So it's EliteFirstAidInc.com. That's the website. We've been dealing with this company for years now. We've sold tons of their kits. We carry a full line of tactical medical supplies in the shop. And we're a full-service gun shop. We're there to deal with firearms. But you know what? Medical kits are critical. If you're going to go to the range or you're going to go out in the field in the middle of nowhere and train with firearms or just go out recreational shooting, you'd better have a medical kit with you. because if there's a problem, you're going to suffer greatly. So let's talk a little bit about what we have available. This is called the Tactical Trauma Kit 1. I'm not going to open these up. I've opened this up in a past video. This is a basic first aid kit. It is one step above a boo-boo kit, which is a minor first aid kit. It's not really designed, they call it a tactical trauma kit. If you take a serious gunshot wound, this is not the right kit for that. This is designed, and you can enhance this, you can build it up, and you can add things to it. I'm experimenting with this particular kit by adding other items to it that'll bring it up to more tactical level, but I'll explain the difference in that in the others. So they're very inexpensive. This particular kit retails for $36.95. It's not bad, but you can use it to build it up. It's got the MOLLE straps on the back, so it'll attach to your gear. You can attach it to a belt if you're just out in the field without all your tack gear, but it's a good little kit to start with. All of the items are listed on there. That's something as a basic model. But my favorite ones are the level 1 and the level 2. And this is what we call a drop leg. And I think I've demoed this before. What you have here is a series of straps that come up. The bottom strap goes around your leg. And I prefer to keep my medical kit on my leg. The way my gear is situated, I like to know that when I take off my tack vest, my medical kit is still attached to me. A lot of you guys are carrying your Ifaks on your vest. So if you take a break and you take your vest off, you're leaving your Ifak there. Make sure I like it attached to my body. That's personal preference. So the level 1 and the level 2 kit use the same exact carrier with a full drop leg system. But you can take the straps off of here, and it's got MOLLE on it, so you can attach it to your web gear the same as the tactical trauma kit. So it's very versatile. It's a good modular kit. What is the difference between a level 1? Now this is called an enhanced Ifak. Now there's a lot of discrepancies out there in terminology. The military changes things all the time. So let me just go over it real quick. An Ifak used to be called an individual first aid kit. Now it is called an improved first aid kit. So it's better than the original kits, and I'm dating myself back to the 80s, but they weren't that good. This is an enhanced kit. It's a little bit better than what a basic individual first aid kit is, but there are 3 items that are not in this particular kit that are in the level 2 kit. Now the level 1 at the retail level is $69.95. This one is $149.95 because the items that are in here are very expensive. So what's the difference? Number 1, this kit does not have a chest needle. Okay, a decompression needle for dealing with a tension pneumothorax. That's important. The chest needle is in the level 2 kit. The other thing that's in here is a different type of tourniquet. It's called a TK4. It's like an elastic band type tourniquet. In the level 2 kit, this has the CAT, the Combat Application Tourniquet, which by themselves are expensive tourniquets. They're in the $30 range. The other thing that is not in this kit that's in the level 2 is the chest seals. Okay, you take a sucking chest wound, this has the chest seals in it. So those are the 3 main items that are different. That's why I recommend a level 2 kit. And then you can add to it your own personal antibiotics that you're not allergic to, and your own pain meds, whether it's acetaminophen or ibuprofen. And there's a couple of other items you may want to add to your level 2 Ifak. The main item I added to mine is I added a quick clot gauze sponge, the big one for a huge wound. That's the largest one they make. Those by themselves are almost $55 or $60 for one quick clot gauze. The stuff's very expensive. So I've added that to this. So my kit probably at the retail level is well over $200. But it's a good way to set it up, and it's what we recommend everybody have. Let's talk a little bit about a larger kit now. This is called the M17 Medic Bag. Okay? This is a tri-fold. It folds out. You've got 1, 2, 3 compartments. You've got a larger compartment here for larger items. You can put your chest seals down in there. This has several smaller compartments. And you can enhance this kit and add a lot of things to it. What we recommend you do is definitely add a couple of tourniquets, Israeli pressure bandages, add a couple of quick clot gauze or compression gauze to it. But the way this kit is designed, it can be opened up rather quickly. It's very light, and when it's all covered up, you got a strap on the side, a carrying strap, but it also has MOLLE. If you want to attach this to a ruck or on the back of your vest or something, I recommend not doing that because you want to be able to get at it quicker. But definitely carry it over your shoulder. What it is just designed to handle a larger amount of casualties, especially in a military environment or in a mass casualty shooting, which we are going to be looking at. This is a lightweight kit that you can carry it with you. It doesn't weigh anything. Add some good stuff to it. That's a good way to go. These are not expensive. This kit actually retails for $64.95. Everything that's in here right now is for basic minor first aid. There's not really anything in here for tactical trauma. That's where you're going to add your chest seals, your chest needles, your hemostatic agent impregnated gauze, which is nothing more than kaolin clay. That's your quick clot gauze. And then definitely a couple of quick clot sponges would be a good idea to add to it. Add a couple of NPA, nasopharyngeal airways, maybe an OPA kit that comes with all 6 or 7 sizes. That doesn't take up any room, just throw that in there. And then you can begin to build on this and have a really good quick kit. This is a good one to keep in your vehicle. Okay, it's one that we recommend for vehicle use. So that's the M3 Medic Bag. Now, let's have some fun. All right. You old timers out there like me, this actually was just prior to my service time, and this is called an M17 Medic Aid Bag. For you Vietnam veterans, you will recognize this because that's where this kit was more widely used. By the time I got in the military, I enlisted in 1979, and I served in the 1st Ranger Battalion, and our medic bags were a large rectangular kit. It was replaced this. They felt that was a little better way to go for airborne troops. This one is less likely to be seen on airborne ops because it's kind of bulky, but it all depends on your mission. But this opens up into 3 segments. The one that we had was just one big compartment, which worked rather nicely. But this one has multiple pockets on it, and there is just a ton of stuff in here. Again, this is designed more around minor to larger lacerations, thing of that nature. As far as gunshot wounds and things like that, you're going to want to add to this kit some tourniquets. You're going to want to add some quick clot gauze again, and definitely some chest needles. So what you're seeing is something more like Combat Lifesaver here, something more platoon medic size, or a more advanced kit for a field team depending on your mission. But the way these are all designed, there's a ton of extra room in all of these kits to enhance any way you want. Again, it's mission specific, but what we always recommend is think gunshot wounds. If you're fortunate enough to have somebody trained in all of this and you're in a mass casualty situation, you're going to be able to save lives. Where we're losing a lot of people in some of these massive shootings is because they're not trained, they're not equipped. I'm also part of a group that trains church security teams. And what we put out to folks, and a lot of folks don't know this, but there are more shootings in churches than there are in schools. You don't hear about it because the radical left doesn't care about what happens to a church. They hate religion. They hate all of us Christians. So that doesn't get publicized near as much unless it's part of an agenda for gun control. Then you hear about it all the time. But what you don't hear about are the details of the shootings themselves. And the problem with that is a lot of churches are not trained or equipped to deal with that. So we're preparing church security teams to also be ready for communications. They've got to have radios to be able to communicate with each other, but they've got to have their medical training. And what we recommend all of our church security guys each carry an Ifak, preferably a level 2, the best one you can get with the most enhanced equipment. then you should have something like this or a larger bag for mass casualty. And then what you get into basically is just large amounts of everything the same you're carrying. So on a mass casualty kit, you might have 10 tourniquets, you might have 10 Israeli bandages, and you just build it up depending on your congregation. But as we have seen in the past, we use the Texas church shooting as an example, but most of these church shootings end up with quite a few casualties. So you're going to want to have a larger kit depending on your congregation and how well your guys are trained. What we always recommend is ask your congregants, who here is a trauma doctor? Who here is a nurse? Who's an EMT, a paramedic, law enforcement? Law enforcement these days is all trained up to deal with massive gunshot wounds out there. So you're going to want to know who those people are, and are they carrying equipment with them? Do they have it? Is it somewhere close by? And this is what you're going to teach your people to do in your neighborhood preparedness groups, the same thing. This is a perfect kit for an NPG so that you can have it on hand. You tuck everything back in there, you strap it all down. It's got backpack straps, so you can have a field medic or a nurse that can grab this kit and move to an area where there's been a series of gunshots go off and there might be casualties. So there's just a ton of stuff that we can train you in. If you come to our trainings, we meet the second and fourth Saturdays of every month. We go over this type of training and we work with these kits. The next one will demonstrate. I'm going to have to order another one. We sold the last ones we had, but a Stomp Kit, which is a full-size monstrous backpack, something you would see more Navy SEAL medics or Delta Special Forces medics. You know, these guys are just the top of the line. They carry what's called a Stomp Kit, and we'll bring one of those in. So that's the basics on med kits, guys. If you have any questions, just write, email, call us, and we'll be happy to help you out. Thanks, and have a great day.